It's informative, it's healthy, and it's the news. Welcome to the Health Connection.
Welcome to this month's episode celebrating National Minority Mental Health Awareness Month.
Hello, everyone. Happy Friday. My name is Kishi Martin. I am the Health Promotion Peer Navigator for Care Resource, as well as your host for the Health Connection. Today's episode will be discussing National Minority Mental Health Awareness Month. And according to the National Alliance on Mental Illness, this initiative began in 2008 and was created by B.B. Moore Campbell. This year in 2021, their campaign is focusing on You Are Not Alone. And joining me today to discuss this topic are two professionals that I have the honor of working with. First, I would like Jennifer Palmer to introduce herself.
Hi, good afternoon, everyone. My name is Jennifer Palmer. I am a clinical counselor here at Care Resource, and I am privileged to be here today to honor this discussion.
Thank you so much for being here.
You're
and
welcome.
Last but not least, Clayton Harrison. How's it going?
Good afternoon, everyone.
Yeah.
Hey guys,
ahead.
My name is Clayton Harrison, a clinical counselor here at Care Resource. It's a privilege to be here today to talk to you guys about this very important topic. So yeah.
Thank you all so much for being here finally. And we are going to get into our first topic. What is mental health? What are the benefits and rewards of seeking mental health help and support?
Well, for me, the benefits of seeking mental health is individuals learning coping skills to deal with daily stressors, learning to be empowered where they never felt they could be. So this is a way of, having clients come in and creating that safe space for them to be able to be vulnerable and, create a rapport with them.
For the first question of what mental health is, we kind of have to look at that a little more deeper because it's a term that gets thrown around a lot. Mental health. Mental health is all about, our physical well-being, our psychological, our emotional well-being, and social as well. It's about how we think about certain things. Are we thinking about things clearly and fully and rationally? Our emotional intelligence. Are we aware of our emotions? How do we manage them? How do we express those emotions? And then behaviorally as well. How do we respond in certain situations? When the emotions are overwhelming, how do we respond? How do we cope with those stressors? Whenever there's any sort of challenges in any of those areas, then it is recommended to seek professional help and see a therapist. And one of the benefits is being able to resolve those issues, being able to gain insight into why we do some of the things that we do. Building self-confidence, building your self-esteem. A lot of those are some great benefits towards therapy. And they should definitely be addressed and worth doing. So it's about getting to be your best self.
I absolutely agree with the both of you. And now we are going to address misinformation and stigma. How do you, as professionals, address the resistance towards care and therapy?
How do I address the professional resistance towards care and therapy? Well, for me, the minorities, speaking on African American individuals, that information, we never thought that therapy would be something that's important that we would even seek to do, because growing up in a specific family unit, African American was like, whatever goes on, stay here. We don't talk about our issues. we always go to the church and deal with the things that we have encountered. But therapy now is, creating that safe space for them, building rapport, allowing them to come in and, feel like someone is listening and being offered hope to, their situations, and allowing them to just to feel safe is one of the key things that I feel that is important for professionals dealing with mental health illness. Having them just to know that somebody's there to listen, because sometimes they just need someone to listen to them. So that's how I address those resistance and the stigma of mental health, thinking that, oh, I'm crazy. No, you just have gone through a crisis at a moment and you can't cope and deal. So you need some assistance to get, stable. And the assistance is here for individuals to seek therapy.
I know that's right.
Yes.
Clayton?
Yeah, I agree. Definitely what Ms. Palmer said. There is a lot of stigma around mental health, especially in minority communities. The messages that you receive, keep it all in the house. What's said here stays here. I mean, even the indirect messages you receive in gender roles, as far as men and women. And some men take on this image where you can't show any sort of vulnerability. So that means showing any sort of emotion that may be considered more of a feminine quality. So they try to mask those emotions. And when they show those emotions, you get messages like, you have to man up, you have to be tough. So we're teaching them to mask our emotions, and that causes other issues in the future, anxiety and depression. How do we process traumatic experiences if we can't open up and share our emotions? In therapy, we have this saying, role resistance. And what that means is seeking to understand where they're coming from, where their past is, how they've been oppressed by society. We have a tendency as individuals to kind of fear what we don't understand. So part of my role as a therapist is to provide some insight, to shed light on their darkness, help them to understand their emotions, help them to understand what they're dealing with and working through it. And by being able to work through it and process that information, they can move forward and becoming the best person that they're meant to be. So in any resistance, finding out where it comes from, finding out what's their purpose for therapy. Also clarifying what therapy means for that individual. Some people have different perceptions on what therapy is like. So being able to communicate and clarify any misunderstandings they might have in terms of what therapy is. Some people even go through life trying to work on challenges on their own because they feel like they have to be independent. They have to be self-sufficient. They have to be this protector as the society puts onto them. They have to be this fixer and manage all issues, and don't realize that that's something they can work on in therapy. You can manage issues with help, and that's what we're here for.
Absolutely.
Everything you all just said on this last one is just spot on, and I'm so glad that you all are sharing this information. And with that, we're going to transition into our last segment, which is services and treatment. What kinds of therapy are available to patients, and how can they access these services easily?
We're here at Care Resource. We offer, a variety of services. We have individual, we have families, we have couples therapy. We have even qualified professionals who have got certified in certain areas of professionalism, for us EMDR, trauma-informed care, CBT. These are some of the interventions that we use to help our clients cope and deal with daily stressors or just emotional things that they, find difficult to manage in their daily lives. These services can be accessed through Care Resource, coming in, online, getting registered through our organization, and then sometimes just walking in and getting registered, and then, getting the service they need provided by, letting us know what you need. We're here to help you. So coming in with the mindset of what they need and how they can be assisted.
Clayton?
In addition to that, one of the things we do when clients come in is we do an intake assessment. So we kind of gather information from the client about what's going on in their day-to-day life. And from there, we're able to refer them to other resources that are available. Here at Care Resource, we have what's called a one-stop shop. So we have a lot of different services to offer. Not only mental health therapy in terms of individual, family, and couples, as Jennifer mentioned, groups in terms of support that can be there. We have case management, psychiatrists, which is important for medication management. Some people with different diagnoses, anxiety, depression, having someone to help manage that medication so they can kind of stabilize everything. So we have a lot of different services. A lot of things are available, but first is just finding out what's needed. And then we can refer you to whatever services may be beneficial for you.
Awesome. I actually have a bonus question, and I hope you all have an answer for me, but I'm fairly confident in both of you. But in the next 5 to 10 years, where would you like to see support surrounding mental health go?
For me, I think it would be more or less in the homeless community, inside the prisons, having more counseling there, just having therapists there to assist them in their trauma experiences.
Right.
Because a lot of times being incarcerated, they just want to give you medication and that's it. There's no one to sit down and hear you talk about, your life, your childhood, things you done been traumatized by.
Right.
So I would love to see it in the prison systems for men, women, adolescents, whoever that's incarcerated and need that assistance. I would like to see it, geared towards that.
Awesome answer. Clayton?
Jennifer actually brought up a good point in terms of the incarceration and how some people come symptoms they may experience as a way of surviving whatever that circumstance was. And some people try to pathologize it and try to say, okay, well, it's anxiety, but it could just be a result of being incarcerated. You learn to be more hypervigilant around with your surroundings. In addition to that, I would like to see mental health kind of break this stigma where we feel like, okay, if you talk to a therapist, you must be crazy. And that's not the case. We all have different issues. We all have challenges in our lives. And it's okay to reach out and say, hey, I need assistance with this. It's okay not to be okay. And part of that is kind of in transition right now. I mean, you have some entertainment figures, Lady Gaga, Taraji P. Henson, some of those big names who are saying, hey, get enrolled in therapy, work on yourself, self-improvement. We want to be our best selves. And it's okay to reach out and say, hey, I need a little bit of guidance. As therapists, we're not here to make you into anyone that you don't want to be. You set the destination, you decide what you want to do in life, where you want to go in life. And we're just simply here to help guide you to get in there.
Yes, absolutely.
Thank you all so much. I appreciate not only your presence, but what you bring to the agency in general and how much support you give to the patients and the clients. They are privileged to have you in their lives. So again, I just want to recognize you all for that. And we as a company, we're all dedicated to wellness overall. And we don't just do it on the clock. I feel like it's so important that we also, in our personal lives, in our relationships, that we're doing the best we can and we're living by example. I mean, me personally, as an individual, I am a huge advocate for mental health and support. So you know that there is no happiness without overall wellness. Like, I think mental health is the most essential part of happiness. And I hope all of our viewers out there are aware of not only the services here, but how important it is to just care that much, not only about your own mental health, but also making sure that your loved ones are invested in on their own terms, on their own time, obviously, invested in improving their wellness overall. So thank you to Jennifer Palmer and Clayton Harrison for joining me this month on the Health Connection in regards to our discussion on National Minority Mental Health Awareness Month. I'm Kishi Martin, your host. I thank you all so much for tuning in, and we'll see you again soon. Take care of yourselves until then.
Don't forget to like us on Facebook at facebook.com/care resource, or follow us on Twitter at careresourcefl, or subscribe at youtube.com/care resource. For more information or to find a location near you, visit us online at careresource.org.